Full arch replacement is a treatment protocol where patients come in and leave with a new and beautiful set of fixed teeth, secured by dental implants that are placed strategically to avoid extensive additional surgeries. It is all done in one day. They're commonly known as Teeth Express, All-on-4, or Pro Arch. It is performed mainly for patients who are about to lose all their remaining teeth or already have lost them. There could be many different reasons why they're losing or have lost their teeth, such as severe gum disease, extensive reoccurring decay, or fear of going to dentist for many years. Having a teeth that is securely fixated onto dental implants will improve the quality of life greatly by being able to smile, eat, and have confidence. Most importantly, not having to worry about teeth. To achieve long-term predictable result, any treatment options that we discuss with patients should start with a diagnosis, a correct one. So the first visit is to gather information with a thorough examination and consultation. We also obtain data such as three-dimensional imaging with CT scan, digital impression of the mouth, photos of patient for smile evaluation and simulation. Once we have all our information, a proper treatment plan is generated with possible alternative options. Then on the second visit, these are reviewed and discussed in depth with the patient. Once patient has full understanding, they'll be scheduled for treatment. Patients ask about pain level, the process as to how long or how many visits to complete, and of course the cost of doing the procedure. Once we develop proper treatment plan, we make sure to discuss all of patient's questions for clear understanding. The way that we plan and execute the full arch treatment is fully digital and guided. To be able to give a whole new set of teeth in one day, everything has to be perfect, has to be accurate and precise. Through digital workup and planning, we're able to solidify all the details of the surgery and restoration, exact number of implants to be placed, their depth and angulations, as well as prosthetic parts, including the new set of fixed teeth. All of this can be planned and made in advance. This way, the surgery will be quick, simple, and predictable without any guesswork. And that's pretty amazing.